A new bill was passed earlier this month that would allow for patients or family members to install cameras in healthcare facilities without being denied.
And this comes after many expressed concerns to legislators about their loved ones being mistreated in these facilities. Fox 5's Danny Mastin spoke with two women who shared their experiences and why this change means so much to them.
Some allow it and some don't when it comes to putting cameras inside of patients' rooms at assisted living facilities in Nevada.
And you don't know what you don't know until you know it.
I know there's things going on without cameras that are being, incidences that are not disclosed, that are being hidden and covered up.
Peggy Stevenson is one who put a camera inside of her mom's room at one local senior living facility and was asked to remove it.
We discovered the ugly, actionable truths that were going on.
And another woman I spoke with who did not want to be identified wanted to put a camera in her mother's room, but was also denied.
I was like, why aren't they allowed? It's her room. No, they're not allowed on premises.
Both claiming their mothers received maltreatment from caregivers at the same facility.
Everything from abuse to abandonment.
She's complained about a little roughness when they come in to wake her and say, it's wake up time. You need to get in the shower.
But changes are being made. AB 202 that was signed into legislation by the governor on June 7th would allow for the patient or their family member to install a camera in their room. Facilities will be required to approve this request.
The patient has to agree to waive any privacy rights and basically hold the facility harmless for any privacy-related issues.
Local attorney Dennis Prince tells me for the family member, it is on them to pay for the camera and to have it installed. And says from a legal perspective, it allows there to be objective evidence of what is taking place inside of healthcare facilities.
Things we repeatedly see in our cases against these facilities is that it's the patient's word against the workers, right?
Stevenson is relieved she will now have a way to protect her loved one.
These places need to be held accountable for the promises that they make, the things that they sell, and the treatment that the residents receive.
Prince tells me his law firm gets anywhere between 6 to 12 calls a year regarding significant issues taking place at assisted living facilities. I'm Danny Mastin, Fox 5 News, local, Las Vegas.